somebody that's having some degeneration in the hip, you would be looking to see right versus left. Is there a limitation in the hip range of motion? Okay, so again, Kirsten, go ahead and lay on your back. So if I'm just looking range of motion in the hip, I'm going to do my 3 supine tests first, so I'm not having my patient flip here, there, and everywhere. Okay, I will first test hip flexion. Okay, again, if I'm looking for hip flexion on this right side, okay, I'm going to take her to end range, and I'm going to measure that. If I'm talking about degeneration, most likely I'm going to compare that with the other side. Okay, so in this case, you're going to do the left as well. Okay, so I check the right, and of course I'm going to take the actual measurement, and then I'm going to come over to the left, so that I can have both of those measurements to see if there's a difference right versus left. Okay, that's flexion. Then we're going to go into hip abduction. Okay, abduction is out to the side. Goniometric landmarks are the 2 ASISs. That's where the stationary arm would line up. The movement arm would follow the femur, the midline of the femur, using the mid-patella as your reference point. Okay? Again, depends on what her motion is like. I'm watching what's happening in her pelvis. I can even put my hand there as long as my mechanics aren't so bad. Okay, my back is straight. And I'm feeling when this starts to move, when it starts to come with the leg. I would then take this measurement right there. That's abduction. It tells me nothing until I compare it to what's happening on this side. Okay. Better to feel what's happening on the other side, but you can also hold here. Again, make sure you're not externally rotating as you abduct the leg. You want to make sure that stays square. And my range is right there. Again, I would take that measurement, see if it's comparable to the other side. If this was done on the initial evaluation, which it should have been, the good leg should not have changed. So in the progress note, which you all would be doing, you can focus on just the right leg. It's okay. Okay, so I just told you have to check both sides. But in true practice, this has already been checked on the first visit. And so for your test, it's going to take too long for you to measure everything on both sides. So I just want you to focus on